My name is Janos Filep. I'm a professor of pathology and cell biology at the University of Montreal. I have just made a presentation at the annual meeting of the International Academy of Cardiology annual sessions in Boston. That I was talking about a new frontier of addressing inflammation in acute coronary syndrome. It has been well established that inflammation underlies all stages of the development of atherosclerosis, from the initiation to the plaque rupture. In recent years, it became evident that inflammation and particularly inflammation resolution is also decreased before plaque rupture. So that it raises the question that is whether we can promote or restore this default mechanism to counter the inflammatory response and promote healing. So that I presented data of two circuits that is based on myeloperoxidase and neutrophil elastase, which are promoting pro-inflammatory mechanism by affecting the lifespan and activation of leukocytes, impairing efferocytosis or removal of apoptotic and damaged cells, culminating in prolongation or perhaps aggravation of the inflammatory response. I also presented data that this mechanism can be efficiently counter-regulated by pro-resolving lipid mediators, lipoxins. It's 15-epimer, which is also known by aspirin-triggered lipoxin, and resolvins. So these lipid mediators intercept the process, the signaling pathways generated by myeloperoxidase and neutrophil elastase, resulting in a decreased cell activation, promoting cellular death, leukocyte death, enhancing efferocytosis, and thereby accelerating resolution of inflammation. But perhaps one step more to the clinical setting, that is resolving, and particularly resolving D1, that is enhanced the resolution of established plaque in the LDLR deficient mice, and it is contributing to plaque stabilization, and it is perhaps preventing the development of acute coronary syndrome. So that is my main message here, that this is a development of drugs which mimic the action of these pro-resolving mediators may represent a novel frontiers to counter the deleterious effect of inflammation under ischemic condition, and thereby may reduce the burden associated with this coronary heart disease.